ever had, 'cause you're so damn beautiful.
Hello, good afternoon, everyone. Welcome to our webinar this afternoon. So this is presented by the Philippine College of Surgeons, together with the Association of Women Surgeons of the Philippines, in celebration of the PCS 85th Foundation Day. Again, we are sponsored by our friends in ABP Pharma. Thanks through Ms. Cathy Carpio. So we prepared a very interesting webinar for you this afternoon, something that is very close to all our hearts, of course. Now that during the pandemic, we are used to wearing all these PPEs and masks all the time. And the most common problem now is the problems that we have with our skin because of all these equipment that we wear on a day-to-day basis. So our topic for this afternoon would be skincare for busy ladies. I will be your host for this afternoon. I'm Dr. Joy Grace Jerusalem. I'm the board secretary of the Association of Women Surgeons of the Philippines, and I will be your host. But of course, before we start, a few reminders. This webinar is also live streamed in Facebook in the AWSP Facebook page and also over at DocWitty. So just a few reminders, please use your complete name. Please close your audio during the lectures. If you have a question, comment, suggestion, feedback, you may raise your hand so that you will be recognized by the moderator later on during the open forum. And you may also choose to type in your questions at the chat box. Okay. So of course, before we start, let's start with a prayer to be followed by the singing of the national anthem and the PCS hymn. The invocation will be led by our treasurer, the Association of Women Surgeons of the Philippines, and she is also the head of outpatient services of the St. Luke's Medical Center at Global City Taguig. Dr. Bernice Navarro will lead us in the opening prayer.
Thank you, Dr. Joy. So let us put ourselves in the presence of the Lord. Lord God, we thank you that you promise to be with us always. Thank you that your presence is with us right now. Today, we give you our hearts, our minds, and our lives. Come speak your words of life into our being. We pray that you would deepen our comprehension, broaden our thinking, and transform our understanding of what we are about to hear in this webinar. For you are our wise counselor, our perfect teacher, and our faithful friend. Amen.
Kayang magiliw, dalas ng silanganan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, tuyag ka ng magiting, sa manlulupin, di ka pasisigil, sa nagatak tutok sa simoy at sa langit mo.
Okay. To officially welcome us to our webinar this afternoon, may I present the President of the Philippine College of Surgeons and the Chairman of the Board of the Philippine College of Surgeons Foundation, Dr. Antonio Sai.
Hello, Dr. Anita Taretecan, President, Association of Women Surgeons of the Philippines, officers, fellows, friends, good afternoon. I'm truly honored to be invited to another well-thought of scientific event in celebration of our 85th anniversary. If it's an event organized by the women surgeons, it must be the best. That is why I always make sure that I am present. You never cease to amaze me with your topics. You started with distance dancing education, then vacunado ka na ba? Then preggy, belly, eggs, no time to wait by sexy chef, and today, skin care for busy ladies. Indeed, all topics are well chosen and timely. With the aesthetic nature of today's theme, I'm afraid that in our subsequent meetings, I may not be able to recognize you because all of you will be more beautiful than today. Thus, I will make sure that I have a screenshot of all of the attendees today to serve as a baseline. After this webinar, I'm sure that we will look younger and staying younger. Correct, Dr. Rosering? Dr. Irene, your talk is equally interesting, but I am very sorry. I cannot mention the title of your talk. I get sensitive. May your activities keep our college more united, richer, stronger, now more than ever. Thank you for being one of the major forces behind the progress of our college. Thank you and good afternoon.
Thank you, Dr. Sai. And also to welcome us from the Association of Women Surgeons of the Philippines, our Vice President, Dr. Esther Sagil. She is also an Associate Professor at the Department of Surgery at the UP College of Medicine, and also the Training Officer of the Division of Pediatric Surgery of the Philippine General Hospital. Mames?
Good afternoon. Good afternoon, Joy. Thank you so much for the introduction. And good afternoon to all our participants, our attendees, and viewers. Typhoon Julina has left, leaving behind some destruction, and Kiko has entered the country, but we're not going to talk about them. Iwan muna natin sila. We are going to talk about our skin. The AWSP has always endeavored to think up, drum up the topics that are close to our hearts and that really benefit us, who are always busy with everything that we do, na kailangan na natin ng something to distract us. No? Tayo naman, how do we take care of ourselves? So, this is one aspect of our bodies that we sometimes neglect to take care of. So I'm very thankful that our two speakers have accepted our invitation to give us, to enlighten us on how to better care for our skins. So let's all sit back, listen, relax, and learn from them. Thank you very much, and good afternoon to all.
Thank you, Dr. Sagil. And to introduce our beautiful speakers for this afternoon, may I call on a member of the Board of Trustees of the AWSP and also a member of the Board of Directors of the Philippine College of Surgeons Metro Manila Chapter. May I call on Dr. Joan Tagorda to introduce our speakers for this afternoon.
Thank you, Joy. It is my pleasure to introduce our two esteemed speakers for this afternoon. Our first speaker is Dr. Irene Gail Robredo Vitas. She is a board-certified dermatologist who enjoys teaching and giving lectures here and abroad. She finished her training in dermatology at the Skin and Cancer Foundation and was 8th place in the Dermatology Board examinations. She is presently a clinical instructor at the Skin and Cancer Foundation training program and a dermatology consultant at the Asian Hospital, St. Luke's Hospital BG, Global City, and Derm HQ Dermatology and Laser Center. She specializes in aesthetic and procedural dermatology particularly cosmeceuticals, injectables, lasers, and energy-based devices. Our next speaker is Dr. Jocelyn Ann Ganaban. She is a board-certified plastic surgeon, a fellow of the Philippine Association of Plastic, Reconstructive, and Aesthetic Surgery, and the Philippine College of Surgeons. She finished her plastic surgery training at the University of Santo Tomas and was a consistent top-notcher in the plastic surgery residency in training examinations. She is also a prolific speaker and a researcher who has won various research awards. At present, she is an assistant professor at the UST Faculty of Medicine and Surgery, became the residency training officer of the section of plastic surgery of the same institution, and now the secretary of the board of the Philippine Association of Plastic, Reconstructive, and Aesthetic Surgeons. We are fortunate to have both of them this afternoon to share their knowledge and experience on skincare for BC ladies. Please extend our warm welcome to our speakers, Dr. Irene Gail Robredo Vitas and Dr. Roselyn Ganaban.
Good afternoon, everyone. I am Dr. Gail Robredo Vitas. I will share my slides. Oh, sorry, I cannot share my slides. I think I need permission now. There, thank you. Okay. So the title of my lecture for this afternoon is Aging and Skincare by the Decade, 20s, 30s, 40s, and beyond. I would like to thank the Philippine College of Surgeons and the Association of Women Surgeons of the Philippines for inviting me to be part of this activity this afternoon. So my lecture outline would be as follows. First, we talk about aging very briefly, skin and skincare in your 20s, skin and skincare in your 30s, in your 40s, and beyond. So let's start first with aging. So aging is the process of becoming older, a process that is genetically determined and environmentally modulated. So you have two influences in aging, your intrinsic factors like your genetics, as well as your extrinsic factors or your exposures. So in your 20s, it is when you should be getting into the habit of doing a good skincare routine that works for you and you're willing to follow. So the 20s lifestyle, I'm sure most of us experience staying up late, partying, drinking alcoholic beverages, which can actually dehydrate the skin, experiencing stress from work, excessive sun exposure, and sometimes smoking, which can all have consequences if we don't limit them or cut them out. The good thing about being in your 20s is that it's also at this age that our bodies recover pretty quickly. For example, I remember, well, compared to now, when I was in my 20s, even if I get drunk the night before, when I wake up in the morning, it's as if nothing has happened because our body's still young and it can recover pretty fast. And our skin, up to our mid to late 20s, still make collagen. And this is why those in their 20s should focus more on prevention, because what you do at this time can reflect and really affect how your skin will look 15 to 20 years later. And I would always tell my patients, I wish someone told me this before, because I only started applying, sunscreen and paying attention to my skin when I was 26 years old already. And I'm paying a big price for all my years of no sunscreen use with pigmentation. Now, what are the skincare routine and products that I recommend for those in their 20s? So of course, you must have a good cleanser. something that cleans your skin well enough without stripping it off of its lipids and moisture, like your soap-free cleansers, for instance, with gentle surfactants and a pH of 5.5. A moisturizer, which contains ingredients like your antioxidants to combat skin stressors that you encounter throughout the day, those that keep your skin hydrated, like your ceramides, or those that keep your sebum production at bay, like salicylic acid and niacinamide. And then, of course, your sunscreen, which should be broad spectrum with an SPF of at least 30 or a PA++, applied correctly and reapplied as needed. Now, it's fairly easy in your 20s. But you have to remember also that the more ingredients or products you use that you don't need, the more chances that those with sensitive skin will have reaction. So at this age, I really don't recommend that you put so many things on your face. I don't recommend that you put anti-aging ingredient or that you exfoliate a lot. I get a lot of questions nowadays because a lot of people are now becoming aware of the importance of skincare. And I have patients 15 years old, 17 years old asking me if they can use retinol or anti-aging products. And I tell them, you know what? No, you only need these 3 things right now because you're not yet aging. So you don't need anti-aging ingredients yet. So in your 30s is when your skin has stopped making collagen. So sad. Both collagen and elastin also start to decline, and the skin turnover starts slowing down. So they said that normally in children, like if you look at your nephews, your nieces, or your young kids, they have flawless skin. That's because they make new skin every 20 days. But as we get older, it becomes longer and longer and less efficient. And it even starts to decline by the time you reach your like 26th year. And that's also when your hyaluronic acid declines, your collagen elastin declines, etc. So in your 30s, for some, it is when they look their best. So I can say this for myself because I feel that, or I felt rather, that when I turned 30, that was when I lost most of my baby fat on my face. I liked how my shape, my face shape is, my jawline became more defined. My cheekbones were the right roundedness. And this is, I would say, for most women, would be the peak of their being attractive, or, you know, their age wherein they like themselves the most. But it is also when new revelations start to come out. It's when we start to notice the consequences of our actions when we were younger, like your pigmentation, fine lines, your acne scars. And it is also when we begin to see the effects of our genetics, yung mga pinamana sa atin ng mga magulang natin, what our parents have passed on to us, like dark circles or eye bags or even large pores. So in addition to the steps 1, 2, 3, and in your 20s, I also recommend the following. So it is when you can start introducing like serums in your skincare routine. So serums are those ingredients or products rather that contain higher concentrations of your active ingredients. For example, your vitamin C, which I prefer to mix with vitamin E and ferulic. You can actually buy them in like one product, all of them. The vitamin E and ferulic acid stabilizes the vitamin C, which of course, I'm sure some of you know to be unstable and easily degrades. You may also start adding eye creams in your skincare routine. So eye creams for me are must-haves. They're not really, eye creams rather are nice to haves. They're not really must-haves because you can actually use your regular moisturizer to treat your eye area if you don't have specific problems. However, if you have issues specific to the eye area, for example, for those experiencing dryness or fine lines, you may apply eye creams containing hyaluronic acid. Or for those with pigmentation problem caused by pigment talaga, you can even apply eye creams containing brightening ingredients. And it is also when you should use anti-aging products and ingredients such as retinoids. So retinoids are still considered the gold standard in anti-aging. Apart from being anti-inflammatory and apart from being antioxidants, more importantly for aging, they regulate skin turnover. So, di ba, remember, it slows down as we age. So when you apply retinol, it makes it more efficient again, makes it regular again. It improves pigmentation, slows down collagen degeneration, and even stimulates collagen production, which results in less fine lines and wrinkles and a smoother, more even toned complexion. So what are examples of retinoids? We have starting from the least potent to the most potent, we have our retinol esters. followed by your retinol, and then your retinaldehyde or retinol, and then your prescription retinoid tretinoin. And apart from that, it is also when I recommend regular exfoliation, which helps boost skin turnover. So like I said, it's not as efficient as when you were younger. Apart from that, exfoliation also allows for better penetration of the products and ingredients that you put on your skin. So you can use physical exfoliants like your exfoliating cleansers or do at home peels using lower concentration acids, or even exfoliants in toners, like for example, your glycolic acid toner or salicylic acid toner, or you may consider doing them in clinic with your dermatologist, with or without procedures like laser toning or LED light treatment, with or without on the same day, your chemical peeling. But apart from continuing to prevent more signs of aging from coming out, at this age, we are also starting to do damage control. And we are trying to maintain a blemish-free, even-toned, and plump youthful skin. Now, in your 40s, by this time, you should know your skin well already, and you've most probably identified your main issue. So I am almost at this age. I am 39, and I must say that apart from knowing my skin well and my skin issues, I really like this stage because I feel like I know myself more. I've started to accept all my flaws, and I know what I like already. I know which opinions matter, which advice I cherish and I consider. So I really like this age. But when it comes to your skin issues, because we have been exposed to the elements longer, the signs of aging become more apparent. So apart from fine lines and pigmentation from before, more pigmentation start to come out. You experience a little more dryness, even broken capillaries, loss of volume, black skin, and deeper wrinkles. And since women, in particular, start to experience fluctuating hormones, others might notice their pores and old scars becoming more obvious due to the steady decline in collagen and elastin, and may start to feel and experience female adult acne. So what is the skincare routine that I recommend for women at this age? So this is the time when replenishing, repairing, and nourishing, in addition to still trying to prevent worsening of your existing skin lesions and skin conditions, it plays a bigger role. And you will probably be making some changes in your skincare routine and ingredients. So apart from all the ingredients I mentioned in your 30s, you may want to change your moisturizers at this point to something more rich or thicker, like your facial oils or balms, which I like to incorporate in my nighttime routine. And add other anti-aging ingredients like peptides, which are like things that signal the skin to perform things like hydrate, make new collagen, etc., growth factors, and other newer products like snail mucin. So we also have to remember to pay more attention to the rest of the body. So a lot of us, pay attention to the face, but we neglect the neck, the décolletage, the hands, even our body. So we have to remember that the skin is all over and not just the face. And the neck and the hands are two parts that are neglected more often, and they are left behind. Individuals in this age group should also consider doing in-clinic procedures like injectables, deeper chemical peels, laser surfacing, or energy-based devices such as radio frequency and ultrasound with their dermatologist to further improve their skin. And apart from that, I always tell my patients, don't forget to do a lifestyle check. Remember, everything that we do on a daily basis affects not just our body, but also our skin. Are you sleeping enough? I'm talking about restful sleep. It is recommended to get at least 7 hours, which I don't get a lot of. Exercising regularly is also recommended, and taking a much needed break from the daily grind. So now we go to your 50s and beyond. So at this age, at least for women, menopause has arrived. So you start to experience low energy levels, fatigue, weight gain, memory loss, and insomnia. and hormones are at deficient level. So in your 50s and beyond, of all the possible influences that contribute to skin aging, in women in particular, estrogen plays a major role. Why? It's because estrogen increases collagen, elastin, blood flow, skin thickness, and fibroblast viability. It increases moisture and skin turgor. It inhibits matrix metalloproteinases or MMPs, which are known to break down collagen. It aids in wound healing. It stimulates hair follicle growth. It is a natural antioxidant that protects the skin against oxidative stress and inflammation, so that when estrogen starts to decline, you may start experiencing skin atrophy, dryness, even itching, loss of elasticity, and increased laxity. Now, what is your skin mission at this age? So our goal is not to look 20 or 30 years younger, but to age gracefully. And apart from everything else that I mentioned earlier in your 40s, sun protection is a must. So, I mean, sun protection is a must even before, but you really want to emphasize this because not just applying sunscreen, but also wearing protective clothing and seeking shade, because it really can add and can aggravate to your existing skin problems. And of course, again, since your estrogen declines, you will also start to experience really dryness of the skin. So I recommend using moisturizers that are richer and thicker with a lot of emollients, humectants, and occlusives in whatever form you like. You can have it in serum form, cream form, balm, or oil form that hydrate, brighten, repair, and soothe the skin. And remember to invest in skincare products that work well on your skin. So there are a lot of good brands out there. I always recommend to use or trust a brand that has worked for you and that has given you good results. And also remember that this is the time when the more obvious signs of aging come out, like deeper wrinkles, more sunspots, crepey texture, and loss of volume, all of which require a more deliberate treatment plan consisting of more specific types of procedures like your suspension threads maybe, or your soft tissue fillers, your botulinum toxin injections, and again, your lasers and energy-based devices. So ultimately, like I said, it's not about wanting to look 20 or 30 years younger. Rather, it's about aging with grace and looking the best version of yourself at whatever age you're in. So Coco Chanel once said that nature gives you the face you have at 20, but it's up to you to merit the one you have at 50. But I think this is my favorite saying by Susan Sarandon, or quote rather. She said, "I look forward to being older when what you look like becomes less and less an issue, and what you are is the point." So that ends my lecture on skincare and skin by the decade. I would just like to add a special request, a few slides on Mask Me. So as medical practitioners, we are considered to be in a profession at high risk for developing occupation-related skin dermatosis. This is because we are exposed to a variety of cleaning agents, medications, latex, a variety of other potential allergens or irritants, especially surgeons. And we have long work hours, which increase the length and duration of our exposure to these elements. We have high levels of wet work and frequent hand washing that can lead to contact dermatitis. We are exposed to needles, lancets, and other sharp instruments, which increase the risk of mechanical injury. And apart from that, or to add on to all of that, we also have erratic and inconsistent eating and sleeping hours and a moderate to high stress level. And because of having to wear PPEs and masks, a lot of us for sure experience maskne. So what is maskne? Maskne is a term used to describe the appearance of acne lesions in areas of the face in contact with or covered with masks and or face shields. This is due to the occlusive nature. When you talk or breathe, the air that gets trapped inside the mask creates a warm, humid environment for a lot of microorganisms to grow, including your bacteria and your yeasts. And apart from this occlusive nature, the term that we call acne mechanica, which is triggered by excess heat, pressure, and friction of rubbing by the mask. For example, when you talk, when you move your mouth, of course, it rubs. All of these compromise your skin barrier, which makes us more vulnerable to infection from these organisms. So how do we avoid and minimize the risk of developing mask? Of course, one would probably tell you, they don't wear masks, but of course, it's impossible. Even pre-pandemic, us medical practitioners, we have always been wearing masks. So it's important to properly clean your face before and after wearing masks. in the evening or when you get home from work after 6 to 8 hours of wearing your N95 and your PPEs and your face shield, double cleansing is recommended. So double cleansing is cleaning the face twice, using first an oil-based cleanser, followed by a water-based cleanser, or using your gentle cleanser twice. And after that, it is recommended that you apply ingredients that restore, replenish, hydrate, and repair your skin, such as those containing your antioxidants, vitamin A, C, and E, and your anti-inflammatories like niacinamide. It is recommended also that you exfoliate regularly, gentle exfoliation, to prevent buildup of dead skin cells, oil, and debris on your skin. Avoid using makeup or irritating and drying ingredients on your face before putting on a mask. And apply a protective moisturizer to preserve your skin barrier and protect against friction and pressure. So a lightweight moisturizer will do. Even a moisturizer with SPF will do, since you're mostly covered the entire time anyway. For those wearing tight N95 masks, silicone scar sheets on pressure points, like here and maybe here on the cheekbone, can help, but just make sure not to compromise the seal of the mask. Of course, minimize touching your face. Make sure that the mask you are using is clean. Well, I don't have to worry about this with us doctors. And when using washable or reusable masks, such as when you're not on duty or you're not in the hospital, make sure that they have been washed with gentle cleansers or cleaned properly. According to studies, 100% cotton masks allow the skin to breathe more compared to other types of masks. But then again, it's more important to find one that suits your skin and at the same time gives adequate protection. So with that, I end my lecture. Thank you for listening.
Thank you, Dr. Robredo Vitas, for that very interesting lecture. Now we go to our second lecturer, Dr. Ganaban.
Good afternoon, everyone. Can you see my slides? Hello?
Yes po.
Yes, ma'am. Yes,
Okay, thank you. So good afternoon, everyone. Dr. Irene already discussed extensively skincare. So we'll proceed to some lunch break procedures for busy ladies. So looking young and staying young. So plastic surgery has become the darling of the media, and no other field of medicine is famous or as infamous as plastic surgery, because even the lay people are very familiar with plastic surgery procedures. And most people think of plastic surgery as superficial and for those who seek perfection. However, what we really aim for is not only for physical beauty, but the emotional and psychological well-being in our patients. So as one of the foremost plastic surgeons said in 1597, an Italian named Tagliacozzi, he said, "We restore, repair, and make whole those parts which nature has given away, but which fortune has given, but which fortune has taken away, not so much that they may delight the eye, but that they may buoy up the spirit and help the mind of the afflicted." So these blessings from nature that fortune and time as we age has taken away, we try to restore, but we don't want to, for a 50-year-old or 40-year-old, like Dr. Irene said earlier, our goal is not really to make you look like a 20-year-old, but to make you look like a young 40 or 50-year-old. If we consider beauty in the Christian light, and if we respect the conditions set by our moral teachings, then aesthetic surgery is not a contradiction to the will of God. It is what restores the perfection of that greatest work of creation, man. So, although there are some who say that plastic surgery is for the vain and it's an affront to God's creation, some people actually beg to differ. And this quote that I posted here was actually said by Pope Pius XII in 1958. So we all want to realize our dream of finding the fountain of youth. But like I said, our goal is not to reverse time, but to delay the effects of time. Oops. Sorry. Okay. So when we're dealing with restoring or delaying time or making someone look more youthful, know and are well versed with the anatomy of the patient. So the important surface anatomy in the face will be the tear trough, the presence of the prolapse orbital fat in the aging face, the presence of and development of a deep palpebromalar groove here as the orbital fat descends and herniates over the orbicularis retaining ligament. We also start to develop the presence of malar bags. And then a mid-face groove as the malar tissue, soft tissue begins to descend into the jowl area. And then we also start to develop the marionette lines here, or grooves from the mouth down to the chin. For the same reason, when the cheeks start to descend down because of gravity. And of course, you're all familiar with the prejowl sulcus, which is a depression here between the chin and the presence of the jowls. Okay. So here are the changes between a youthful and aging face. For the youthful face, you can see that the distribution of the soft tissue is more elevated compared to the aging face, where everything has partly atrophied as well as descended because of gravity and laxity of the tissue. And then for the muscles and the bones, you can see that in the youthful face, the muscles are bulkier and tighter compared to an aging face, where there's again thinning of the muscles as well as some laxity and lowering due to gravity. Okay, so one of the very useful medicine that we use to reverse these changes would be a botulinum toxin. So these currently there are two types, botulinum toxin A and B. They're very useful because they have very predictable results as long as you know your anatomy. They have minimal risks, no downtime. We use this to paralyze the muscles. And of course, like I keep mentioning, it requires an extensive knowledge of anatomy. So the botulinum toxin, it inhibits the release of acetylcholine by cutting SNAP25. This is a protein that allows binding of the synaptic vesicles with the nerve endings. So because it inhibits the release of the acetylcholine, it takes a few days before you can see the final results because there are still vesicles in the neuromuscular junction. So that those vesicles are still present, they will be able to release still the acetylcholine that they contain. So it on average takes about 3 to 5 days before you see the final results for Botox injections. So here are some samples. You can see here on the left. This is a fairly young male patient, about in his late 30s, but you can see when his smile, the Duchenne sign, which is the crow's feet here, which are extensive and deep. And then he also has a hypertrophy of the inferior orbicularis oculi muscles. Okay, so it's not really eye bags, but although he does have some excess skin roll also in the lower eyelid. So his primary concern is the excessive folding on the lateral orbital area. So we address that with Botox injections. Okay. So this is after the procedure, about 5 days to a week after. So the Botox injections have already taken full action. So when he smiles now, those lateral orbital or crow's feet aren't visible anymore. And you can also see how, because of the injection of the Botox in the lateral orbital area, it also inhibits the pull on the upper eyelid, so that the upper eyelid isn't so descended, or it doesn't droop so much compared to the pre-procedure photo. Okay. Then here's another patient. You can see she has some presence of the same crow's feet and also some bulging of the lower eyelid. Now, the lower eyelid, it has several contributors to the puffiness of the lower eyelid. Of course, there's the hypertrophy of the muscle and also the excess skin. But she didn't want any surgical procedure. So we recommended Botox injections. And this is after patient 1 week after. You can see the crow's feet are gone, and also a decrease in the puffiness on the lower eyelid. Also, although you can still see that visibly there's still some excess skin, injection of Botox into the inferior orbicularis oculi muscle already has some markedly decreased puffiness in the area. Then this patient, his main concern is are the forehead horizontal lines. Now, this is typically seen in patients who have ptosis already of the upper eyelids. As you can see here, he has some significant excess skin already on the upper eyelids, and also droopiness of both eyebrows. So the forehead or the frontalis muscle compensates for the droopiness of the eyebrows and the upper eyelid by elevating or lifting up the eyebrows. So that results in a formation of these deep forehead lines. Okay. So after a week and Botox injections into the forehead, you can see how there are no more deep grooves there. But because of that, you can see how the upper eyelid skin is now more evident, the excess there. Okay, because there's no compensatory elevation already or lifting of the eyebrows from the forehead. So typically for these patients, where the cause of the forehead retidis is really the heaviness of excess upper eyelid skin, we also recommend concomitant upper eyelid blepharoplasty. Here's another patient with more marked forehead lines all over. So this would entail much more dosage of the Botox injections, as well as multiple points compared to the previous patient. We just have to make sure that when we're injecting in the forehead, we avoid the lateral eyebrow, because injecting that would paralyze the muscles that lift up the upper eyebrow. And that would result in depression of the lower eyebrow, which makes a patient appear sad or tired. Okay. But at the same time, we want to make sure that we don't over inject medial to this line, because if that happens, the patient will have a Spock eyebrow, where it looks like the eyebrow is overly arched or overly high. It's a balance of knowing which muscles you should paralyze or which muscles you just inject to weaken. Okay. So this is a typical change between the youthful face, which is an inverted triangle with the high cheekbones, the full cheeks, as well as a defined jawline. And then in contrast, this is the triangle of aging, okay, where everything begins to sag and descend, so that the bottom part becomes more squarish in appearance and the jowls become more prominent. Okay, so that's what we want to balance. We don't want to overcorrect and overly lift everything so the patient ends up with a wind-blown appearance, but we just want to target the problem areas of the patient and try to compensate for that. Okay. Okay. So like for this patient, where she's relatively young, but she feels like her face is very round and wide. Okay, so there are several factors contributing to a wide face. It can either be, of course, the skeletal element itself that's wide, a wide jawbone, or she can have a hypertrophic masseter. So this is very common, especially for patients who grind their teeth at night, or they have bruxism, or those who like chewing gum a lot. So that's very common. So you can use Botox to atrophy those muscles. And you can see after the procedure where her face is narrowed down quite a bit. So her face is more V-shaped now, which is the trend now, especially with all those Korean novellas. A lot of patients, both male and female, like that V-shaped look. Here's another patient. As you can see here, she has both very hypertrophic masseters, and her jawline itself is squarish, but she doesn't want to undergo any surgical procedure. So enough Botox injections can lead to a marked decrease in the width of the face by atrophying that masseter muscle. And also at the same time, we can inject in the parotids, especially in the aging face where there's already parotid hypertrophy and also parotid descent. And that can also contribute to the width of the face. So the muscle enlargement is more evident in thin individuals because of their thin and, of course, in Caucasians that have sun-damaged skin. So any slight irregularity or hypertrophy in the subcutaneous tissue is markedly more visible compared to their Asian counterparts. Okay. This patient has what you call marionette lines, which are these lines here from the lateral oral commissure down to the chin. And it's not that as we age, these lines become deeper per se. It's because, like I said, the cheek tissue descend and fold over the retaining ligaments that attach the dermis to the underlying tissue. So the cheek tissue fold over that, and that creates those grooves. Okay, so we can also correct this or minimize this with Botox. We inject it here in the depressor anguli oris. And that also at the same time, depending on the amount you inject, it also at the same time gives a lift to the lateral oral commissure. Because if you notice as you age, it looks like your lateral oral commissures are depressed. So it makes you look sad or even angry. So that also helps there. And here's another patient with more prominent depression of the lateral commissures, as well as you can see, the tissues here look bulky. So again, Botox in the depressor anguli oris would address that. So it decreases the pull on the lateral commissure, so that even here when you see this at the rest, the lateral commissures are elevated compared to the procedure. She's not frowning here. That's really her mouth at rest. Okay. Other targets for Botox would be for neck and jowl rejuvenation. A lot of people often say that you can hide your face, your skin, but it's very difficult to hide the neck during aging. So, of course, historically, this would be addressed by a surgery to tighten the platysma, but we can also address this with Botox. Okay, so we can inject Botox into the platysmal bands, as you can see here, which would lead to tightening of the platysma. At the same time, because the platysma is tight, it also pulls on the chin. So as you can see in the pre-procedural photo, the chin looks retruded or it's not very prominent in appearance because the platysma inserts here into the skin of the face and it pulls down, as well as the cheek, so that at the same time, it creates that bulge on the neck and also pulls down on the cheek tissue so that everything sags down and you lose the definition of the angle of the jaw. Okay, so Botox here would be very useful in releasing those pulling points, and also creates a definition at the same time in the angle of the jaw and releases the chin so it becomes more, the angle becomes more prominent here. Of course, you don't expect that it will also address the lax skin. All right, like I said, we don't want a 50-year-old or 60-year-old to look 20. Just want them to look like a young 50 or 60. Okay, here are further samples. Here's the prominent neck band. Again, pulling down on the chin, as well as the angle of the jaw and cheek tissue so that everything looks blurred already. And then Botox of the platysma. And it has to be in multiple points in small doses. Increases that angle of the chin and the neck, and also increases the contour, or makes the jawline more prominent. Okay, so you can inject Botox in a lot of different places in the face, depending on what your goals are and what your target areas are. So you just really need to know your anatomy, right? So here's a short joke. So here are the prunes. They saw this fresh raisin and they're accusing her of getting Botox. Okay, so another lunchtime procedure for you busy ladies would be filler injections. And these are hyaluronic acid and collagen. These are the legitimate filler injections, not silicone. And they're normally part of your body. So they're temporary. They last about 1 to 2 years. Newer products claim to last up to 3 years. And eventually they will just be absorbed by the body. So there are still no safe permanent filler injections at this time. Generally, they get injected under the skin or even down to the subperiosteal plane, depending on what your goals are. So again, I stress the knowledge of anatomy. So here's a patient with, as you can see, he has depression of the malar area because of gravity. So usually for patients who have multiple concerns with their face and rejuvenation, we actually recommend a combination of Botox and fillers for optimal results. It cannot be just one or the other. But of course, if you just want to correct tiny points or target areas, you may just use one or the other. But for optimal results, best is to combine the two. Okay, so for this patient, you can see the deepening of the jugal grooves here with what appears to be loss of tissue in the infraorbital area, as well as the marionette lines, of course, and the grooves here where the jowls appear to be. So after filler injection in the malar area and the infraorbital area, as well as Botox of the in this area to increase the definition of the jawline, you can see how she looks a lot more refreshed. So for Botox and fillers, we always tell the patient that the goal here is not to make you years younger per se, but to make you look more refreshed. And because in general, as we age, we begin to look so tired and even sad because of all the contradicting actions of the muscles. So that's what we want to correct. Okay. All right. So this patient, again, not pre-operatively, pre-procedure, you can see how she has lost the definition of the malar area. So she just wants fullness. So filler injection for the malar area to make the cheeks look more rounded, In the pre-procedure photo, you can see how the cheeks look like they're down here already. So after filler injection in the zygomatic area, looks like her, the apples of her cheeks are more defined, and she looks younger just from that, and she looks more refreshed. I keep saying the word refreshed. Okay. Okay. So for this patient, her concern is she has a retruded chin. Okay, so when a patient comes in with a retruded or very short chin, several problems would be, one, of course, on lateral view. There's a lack of proportion between the upper half of her face and her lower chin, so that she has a convex lateral appearance. And because of the action of the mentalis muscle here and the long arm of the muscle, because it's retruded, it also pulls on the lower lip. So the lower lip tends to be long and thicker. It looks thicker, like the patient is always pouting. Okay, so a filler injection of the chin would make her profile more proportional. Just that, just a filler injection of the chin. And then a lateral view, you can see how the lower lip now looks more relaxed because the muscles aren't pulling on it. And this is also very useful, again, for the aging face, because if you remember the triangle of the aging face where the jowls become lower, so you can use filler injection of the chin to actually balance out the lower part of the face, so that it creates the appearance of a more oval shape without any need for surgery. And then again, a chin injection here to increase the length. At the same, no Botox injection here, but you can see how filler injection of the chin and lengthening it created that illusion of the increased neck to chin angle or mentocervical angle. It's really just adding to the chin. So it's nice to play with injectables, because you just tweak here and there. You can see a big difference in the face of the patient. So of course, you're all familiar with Kylie Jenner. She's one of the most famous celebrities who underwent filler injections. You can see here pre-procedure. She really has a very thin lips. It's out of proportion to the rest of her face, especially since she has big eyes, the prominent nose, so that there's really nothing here in this area that catches the attention. Of course, she's already pretty here. But as you can see, when she started having the filler injections here, parang she's just trying it out. So it's mainly the lower lip that she had injected, maybe just the rim of the upper lip. So it's now more prominent. And then here is full blown when she started her makeup line. So you can see how it now entirely balances out her face more. Just the filler in that area. And at the same time, because it's fuller, it's able to attract attention so that her cheeks don't look as wide compared to here, and even her nose doesn't look that wide anymore, because it's more balanced, so that a lot of people actually say that she's had rhinoplasty done. But if you compare these, it's the same nose. Just less freckles because she wears a lot more makeup now, but it's still the same nose. It's just that the lips have balanced out everything. Okay. So filler injections are also useful for, of course, as we age, you can notice that your lips lose their volume over time, and especially the white roll or the rim of the lips tend to atrophy as well. So it loses the prominence of that white roll. So filler injections are very good in filling that out, the lost volume, as well as to moisturize the lips. Because our lips tend to get dry. The skin of the lips is very thin, so we tend to lose moisture, and these dermal fillers are also very useful in regaining the moisture of the areas. There's another patient. She has a very pouty lower lip and she wants a balance there. So she had filler injections done more on the upper lip just to balance out the lower lip. Okay. So of course we have horror stories of celebrities, and they should be judiciously used. Okay, so fillers injections are very useful, but you have to know when enough is enough, and you have to be able to tell your patient that they're overdoing it and when to stop, and to tell them firmly that's enough. It doesn't look good anymore. So of course, if you're familiar with Meg Ryan from the 90s, then here's Lindsay Lohan and Renee Zellweger. So you can see how the overuse of Botox and filler injections have markedly made their face look asymmetrical and doesn't really look good anymore. Because most of the time, when they overdo it, it's because they're trying to regain what they looked like when they were in their 20s or 30s, and that's really not possible aesthetically. Okay. So as Sophia Loren said, there is a fountain of youth. It's in your mind, your talents, the creativity you bring to your life and the lives of people you love. When you learn to tap this source, you will truly have defeated age. Thank you and good evening.
Thank you to our speakers, Dr. Robredo Vitas and Dr. Ganaban, for very interesting talks about and lectures about skincare and procedures that can be done. Marami akong natutunan tungkol sa nasa mukha ko ngayon. That's lines pa lang tawag ko. So to lead us in our open forum, may I call on a member of the Board of Trustees of the AWSP and also the current Board Secretary of the Philippine College of Surgeons, Dr. Maria Concepcion Besagas.
Thank you, Joy. That was such a wonderful lecture for us all. And it's not really a lecture just for ladies. It's really for all of us, even men. So now I'm so conscious of how I look after hearing all those. I have questions. For our participants, you are free to type in your questions. And while you don't have questions yet typed in, I will start my questions. So this is addressed to both of you. So when we laugh, should we laugh less? Because it makes us cause wrinkles in our face and make our, ano ba yun, yung mga furrows more prominent. So should we laugh less? Or when we smile, should it be yung ano tawag doon, yung matipid na smile, so as to prevent all those lines and all those things in your face?
Sige, Doc, I'll answer first. For me, no. Kasi, Doc, pwede ka naman mag-Botox eh. So, just inject your toxins and be happy, be yourself. What I always tell my patients lang is to, for example, yung mga avoidable, like when you go outside and it's really bright, to wear shades or sunglasses so that you're not squinting. And for those who have presbyopia, to wear the right glasses para hindi ka nagsisquint. But in terms of smiling and being happy and being expressive, I think you should go ahead. Just inject toxins. Kasi when injected in the right places, they won't naman change talaga they won't alter how you look. You just won't manifest lines. Like ako. Yeah. I'm still smiling.
Si Dr. Ganaban?
Hi, everyone. I agree with Dr. Gail. When patients come in and they complain about wrinkles and the lines and they keep saying it's because when I laugh I'm like this, I keep saying those lines on your face, they tell a story, and you laugh because you've had so much joy in your life. And when we do Botox naman, I'm sure Dr. Gail also does Botox and fillers. When we do Botox naman, our goal really isn't to entirely remove these lines. We just want to minimize them, especially when you're squinting ganyan, and you have those grooves here. Sometimes kasi it's a habit for patients, especially those who talk animatedly. and they frown like that and all that when they're reading. So it's really more of a habit. So what we do here there with the Botox is to retrain those muscles that they shouldn't be moving or they shouldn't be overactive. But those laugh lines, we don't want to totally eradicate them because they're really part of your facial expression. You don't want that really flat look naman.
Okay, thank you very much for that. We all know that exercise is good for the body. Now, because our face is always exposed, in my younger years, there was someone telling me I should exercise my face by doing this. I know it looks funny, but you do this. Does that work? Or are there exercises in the face? Because one of the lectures showed that there was a decreased amount of the tonicity of the muscles in the face. And then you have also everything goes down by gravity. So should we have exercises in the face to tone the muscles to regain all that lifting, in the face? Anybody can answer.
Doctor, there aren't three, although there was one that's recently trending, the mewing, or where they press the tongue against the palate and clench down the jaw to increase the definition of the angle of the jaw. But a lot, yung mga studies naman, there aren't really a lot that support to increase facial exercises will decrease the gravity resulting in in the lowering of those muscles or atrophy. We just have to accept that with aging there will really be some ptosis of the tissues, and the major contributing factor to those really is your lifestyle. So sun exposure, number one. The sun is our enemy. Yun talaga. Believer ako doon, like Dr. Gil. And also, of course, other lifestyle like diet and smoking. And I mean, I'm not a dermatologist, so I don't really tell patients na I prescribe mga skincare, but I personally believe that skincare regimen, daily skincare regimen is important. Don't overly rely and expect dramatic improvements with mga machines, laser, Ultera. Kahit siguro every 3 months ka mag-Ultera, if you don't have that good skincare daily ritual, kailangan sipagan talaga. You won't really see dramatic improvement.
I agree with you, Doc. I didn't know what to say about the muscle because I mean I've heard about it po, but I tell my patients to avoid excessive muscular movement kasi nga you might develop deep lines and wrinkles. But apart kasi po, I guess, from losing muscle tone, you also lose a lot of fat, collagen, and elastin on your face, which contributes to the overall sagging. And yon, parang I'd just like to reiterate lang yung what Dr. Ganaban said about skincare. Ako, when I treat my patients, especially who come to me in their mga late 40s or 50s, dun mo talaga ma-realize that when you treat your skin, it's really from inside and out and outside and in. Hindi siya pwedeng isa lang. And like yung sinabi ni Dr. Ganaban, then pag medyo late na, medyo mahirap na rin siyang habulin with the machines. It's really starting young, and for me, for a 20-year-old who just wants to do something, sunscreen po talaga yung pinaka-important.
Thank you. Now there's a question here. Is there because we all know that our skin is different from the Caucasians, and most of the skin products, is there a particular brand that will be okay for the Asian skin or the Filipino skin?
Brand po, Doktora?
Is there a recommended brand of skin and eye care for Asians, particularly Filipino skin? Pero hindi na to yung, we're not endorsing, we're just saying, is there such a thing as a particular, for Asian skin, there's a difference between your Asian products versus the Western products?
Actually, Doc, very good question. No? And I think that's also important. But rather than, I guess, making it like Asian versus Western, I think it's more like where you are and what your skin type is. Because Asian, when you talk about Asian, Korean is Asian, Japanese is Asian. But if you compare our weather to theirs, malamig sila eh. They have drier weather, less humid. Whereas tayo, we only have 2 seasons, wet and dry, and we're very humid. So that's why um, I do use a lot of Korean skincare products. We cannot really do always the 10, 12 step routine kasi ang lagkit na nun sa mukha, Doc. As in, if you're in Korea, maybe in the dead of winter, 5 to 10 layers would be ideal. But if you're here in the summer at 49 degrees, di naman siguro, patay na tayo nun, 41 degrees out, and you try to put the 12, it really won't work. But so for me po, in terms of skincare, what's important to know is number 1, your skin type, which by the way can change as you change ages. Number 2, your skin issues. Kasi iba-iba po yan. Meron pong may issue pigmentation, meron iba wrinkles, may fine lines, dryness. And then number 3 also, yung ano mo, willingness to do it. Because even if I tell you, oh, Doctora, you have to do this 10-step routine. But if you're tamad and if you're not willing, hindi din talaga. So it's always your skin type, your skin issues, and what you're willing to do. My basic talaga is just a good cleanser, moisturizer with whatever ingredient that you need, and sun protection. And then later on, if you identify even more issues, you can add. When it comes to brands naman po, Western, Korean, European, any, as long as they contain the ingredients and the formulation that works well with your skin, okay naman po yun. Actually, ang dami na po ngayon. And nakakatuwa na nakakalito because I mean, we're presented with so many things and parang unlike before na parang, what, we have 5 brands. Now we have hundreds. And we have even local brands.
Thank you. So that also answers the question regarding the 10-step skin regimen from the Koreans. Is it okay for the Filipinos? It's really about the weather.
If
There's
you have
another
dry skin, Doc, okay lang po.
if
you
for
have
dry skin. Okay. So if there's another question here, is there a role of argan oil in the skincare of senior citizens who prefer minimal applications to their face?
Yung argan oil po is a moisturizer which can act both as an emollient, meaning it's a type of oil kasi that can go in between our cells. Hindi lang siya nakapatong. And it's also an occlusive, meaning once you put it there, it keeps moisture in and sort of minimizes dehydration. So in a way, because when you're older, your skin gets drier, meron talaga siyang role. But I don't think it's enough to do other things like stimulate collagen modeling, improve pigmentation. So if you just want sort of to maintain your barrier and to keep your skin moisturized, I think it has a role. But if you want to do other things, it's not enough po. Kulang siya.
Okay. Okay, Dr. Ganaban.
Parang generally kasi po, most people, they think na one product that works on another person works on them. So like Dr. Gil said, it's really important for you to know your type of skin. Most Filipinos, because of the humid weather, we have combination skin. So oily yung tip zone and then dry yung cheeks. And then as we age, because of aging, that changes so that it tends to be more dry. Yung mga oils, regardless of the oil you use, it should be the last part of your skincare routine. So because of I'm not a dermatologist again. Dr. Gil is expert. I'm just speaking from my personal experience kasi mahilig din ako maglalagay. So because of our weather, we should really go for more of yung mga light na serum type. And then layer that. The secret kasi doon sa mga steps is you have to be patient and willing to wait yung minutes in between. You can't apply one on top of the other right away. You have to wait for it to soak in. So yun, serums nga, generally for, like me personally, I use alpha hydrolic acids. And then I alternate that with siguro once or twice a week with beta hydrolic acids. And then my last step for that would be moisturizer. And then pinaka last is oil.
Masipag ka pala, Doc, magpahid.
Yes. Kaso, I find kasi, like me, I have malassezia acne. So I have to be very particular with the types of oil that I use. So if you look at your faces now, and you have those parang bumps that you think are whiteheads and they come and go, but really they're malassezia pala. It's a fungus that really lives on your skin. So sometimes it overproliferates and creates those what you think are whiteheads. And so you just have to be careful, especially with packing on those very thick moisturizers in our weather. That can really plug your pores pa. So patience and sipag is the key.
Okay. So, narinig niyo yun. So, take a picture of yourselves today, and in a week's time, after all the tips you've learned today, look at the difference. I'm sure you'll be happy with the results. Now, there was in the lecture, both of you talked about collagen. So there was a collagen, what do you call this? It is for the filler, and then also for your also for skincare, etc. Now, is there a role of oral collagen? So collagen supplements for those who are more than 50 years, or oral collagen products? Kakain ba ako ng maraming bulalo para bumalik yung aking glow and the feeling of my face?
Doc, very good question. Kasi ang dami talagang nagpo-proliferate ng mga collagen powder, supplements, capsules. You have to understand kasi how collagen works in our body. So, collagen is found in so many parts of the body, including the skin. So, we have collagen types 1, 2, and 3 on the skin. And by the time you reach now the age of 26, it starts to decline 1% per year. So, by the time you reach your 46th birthday, your collagen would have declined 20%. So, kaya naging popular yung collagen supplements. But what you have to understand about collagen is that it's a large molecule, meaning hindi siya easily absorbed. So, what these collagen manufacturers do is that they hydrolyze it, meaning they chop it off in smaller pieces so that our body can absorb them. But the thing is, when you take in collagen, yung acid sa tiyan natin can degrade it. Okay, so that's number one. So meron mga brands that formulated a vehicle for the collagen to survive that acid and maybe go into our bloodstream. So that's proven. So merong mga studies po, Doc, that show that these hydrolyzed collagen capsule elements, whatever, get absorbed into the bloodstream. But the question is, number one, will they be able to reform into that large collagen molecule? Number two, there aren't enough studies that show that they can actually reach the skin and give benefits. So I am not saying that wala silang kwenta. They have been proven to be safe and they have been seen in the bloodstream, but there aren't enough studies to prove and show that they actually go to the skin. So I think more studies have to be done with regards to that part of collagen. But in terms of safety, and I guess efficacy in other studies, kasi I've seen mga ortho studies and rehab, but in terms of the skin, hindi pa po siya ganun ka-convincing. But if you compare it naman to topical collagen, yung topical collagen naman po, even though they do not get absorbed on the skin, collagen creams and topical agents are good humectants. So they can act as moisturizers that bind moisture into the top of your skin. That's why when you apply them, parang ganda-ganda ng skin mo. So yun po yung take ko on collagen supplements.
Dr. Ganaban, you have something for collagen?
Same, Doctor. There are a lot of studies that say they don't really support ingesting collagen because aside from the gastric acids that can break that down, of course, we all know that we have pancreatic proteases and collagen is a peptide. So it will just really digest the collagen in their gastrointestinal tract. However, there are people naman who report that it really works on them. So over time naman, ingesting these collagen, I guess even for those who reported positive results, it took time for it to work. And even on the bottles of these collagen products, it says that there are no approved therapeutic benefit pa. So studies are on the fence pa din. So if you really want to increase your collagen deposition on their skin, better na lang to have hyaluronic acid or collagen fillers injected in a subdermal para ma-fill up talaga yung lost
Or use
collagen.
retinoids.
Or use retinoids, yes.
Okay, so there's a question here about what is the best regimen for melasma? And siguro pasok na rin natin yung oral glutathione. Is there any role for that for skincare with regards to pigmentation and all of those stuff?
Sa melasma muna tayo, Doc.
Oh, sige.
So, melasma kasi, what you have to understand about melasma, it's multifactorial. So, parang until now, they can't really put the point on a specific cause, but they said that it's hormonal. That's why, di ba, in women, after when you get pregnant, ganyan, or, you know, because of our hormones, it can increase. They also said that UV radiation triggers the formation of melasma, as well as use of cosmetics and skincare products with fragrance and then sun exposure, yung mga photosensitizers. So the treatment will depend firstly on the type of melasma that you have, whether it's epidermal, dermal, or mixed, the location, and then again, your lifestyle. And also more recently, I think I learned about it in 2018. I attended this South American conference wherein what they do when they encounter patients with melasma, they do a dermoscope. And they even do like pictures that check the blood vessels, the pigmentation, and everything. Because there's a big population of melasma patients with a lot of broken capillaries on top. So that even if you keep applying bleaching agents, lightening agents, it doesn't really go away because the blood vessels supposedly feed the melanocytes to create melanin. So marami siyang, it's actually, I think it's ongoing, the discovery about melasma. So right now, parang ako when I treat patients with melasma, I really make sure that I do the dermatoscope, I check for blood vessels, because if it's purely pigment, then I just give lightening ingredients. But if it's a combination of, you know, broken capillaries and redness, I even give tranexamic acid. So it depends. Combination, sun protection, very important. There's a guide, first line, second line, third line. I don't use lasers as my first line. I rarely use lasers for melasma because we know that heat and trauma is also a trigger. But you can use it as an add-on if your patient does not respond to your conventional modalities. So consultation, and it's very personalized, Doc. As in, wala akong parang, oh, pag melasma ito bibigay ko. It's not like that anymore.
Okay. What about glutathione? Anybody would like to talk about glutathione? Oral glutathione. Or IV glutathione.
Glutathione, ay, go ahead, Doctora.
Go, Doc.
Ay, glutathione kasi, Doctora, like, you know, it was originally prescribed as an antioxidant for cancer patients undergoing chemotherapy to counteract yung mga radicals that were formed with the, you know, chemotherapeutic agents and all that. And as a side effect, they noticed na yung patients that they prescribed glutathione, nag-even out yung skin tone and all that. Yung IV, I do think there's an effect sa IV. It does work. However, feeling ko lang no over yung dosages nila. Like there are some who get it administered ng 1 gram fast dose, ganyan, which I really don't agree with. Oral gluta, again, on the fence, same as oral collagen.
Actually, Doc, share ko lang. I remember I attended another lecture from an English speaker. Sabi niya, in the Philippines, you have the most expensive toilets. So sabi ko, paano hindi namin na-get why? Sabi niya, because you keep injecting IV glutathione and you just pee it out. So parang sinasayang natin yung mga pera natin. Because, well, he said that when you inject glutathione, like what Dr. Gnaban said, parang it's used talaga in chemotherapy because they need it. They have depleted all their antioxidant stores in the body because of the chemotherapy. So when you inject the glutathione to these patients, you are replenishing the lost stores. But for someone who has normal levels, when you inject your glutathione in your body, inihi mo lang siya kasi hindi mo siya kailangan. So that's why parang at least our society, we're really discouraging IV glutathione use, especially for skin lightening, because it doesn't work for all. It might work for some, but there's no guarantee that it works for all. And there are other ways naman, if you really want to take gluta, take it orally. You might not get the 500 milligrams that's in there because again of our gastric acid juices, but there are newer variants that come in sublingual form that have studies that they get absorbed better versus the ones that you take orally in capsule form. Madami po talaga kasing gusto. And, you know, parang kahit pa sabihin mong wag, gusto talaga nila eh. So, bigay ka na lang ng, I guess, advice.
Mahal na vitamins.
Yes.
And also, Dr. Corollary to that, there have been also reports of mga nag-renal failure from overly high dosage of IV glutathione.
Okay. So, there's a follow-up question kasi Dr. Ravitas mentioned about tranexamic acid. So, what is that for skincare? That's also used for trauma, you know, tranexamic acid.
Actually, Doc,
For
my
skincare.
my mom is an OBGYN.
I know
parang-
your mom.
Ay, so, kasi may melasma siya, oh my gosh, nanonood ba siya? I'm sorry, mom. So, I gave her tranexamic acid. So, sabi niya, ba't mo kami nibigyan niya? Para sa dumudugo yan Bakit ganyan? Baka mag-blood clot ako. Actually po, they discovered that tranexamic acid helps nga, Doc, to sort of cut the blood supply that feeds yung pigment natin. So, to make it lang more simple. Like I said, I don't give it to everyone. I give it to those lang with visible blood vessels on the skin with the melasma. Because hindi talaga siya nag-i-improve. Meron talagang iba na you will notice, parang, oh my God, ginawa ko na lahat. Nag-peel na ako, nag-bleaching cream na ako, nag-sunscreen, andyan pa rin. And then when you give tranexamic acid in the form of 5% cream or mesotherapy injections, nag-i-improve po talaga, or oral. So you can actually give it in so many ways. So yung mga ayaw mag-oral because may heart problems or they're afraid na baka mag-stroke sila, I usually give it in cream form. 5% is the studied form. Or via mesotherapy. Masakit nga lang po talaga because it's intradermal. Parang siniskin test yung buong mukha mo. But it's effective po.
So it's parenteral, and it's not oral. It's not oral tranexamate.
Oral
but
po. Oral.
Oral. Okay. So there's a
oral
question.
cream for injection.
Okay. So there's a question here. Puro doktor yung nagtatanong dito. Puro ko lahat kilala ko. What do you suggest for visible vessels on the face and upper arms? Ano na lang tayo? Mag turtleneck at saka mag...
Upper arm, Doc?
I guess here in the forearm. In the arm, I guess. In the shoulder, near the shoulders.
Sa face, Doc, if it's spider veins or, oh my God, my mom is here. Sorry, mom. Ayan. For the blood vessels on the face, like reticular veins or broken capillaries, I do lasers. It depends if it's bluish or greenish to reddish. So if it's red, I use pulse dye laser or the yellow laser because they have more affinity to red blood vessels. But if you have like the bluish green, I use long pulse and DIAG. So very effective but quite painful po. In terms of the upper arms, parang wala, Doc, may nakita ka na ba? Parang wala pa ako nakita, Doc, na parang visible veins on the upper arms. But like for the veins dito, I don't normally remove those veins there kasi feeling ko baka importante sila later on. But maybe for the spider veins, the same, lasers or even sclerotherapy if they're really the small reticular ones. Pwede naman po siguro. I've never done it on the arms.
Doctor, a question lang. So, di ba yung mga rhinophyma patients, they tend to have those visible vessels then sa nose. Does it work also laser for that?
Yes. So pulse dye laser or now the newer yellow laser. So meron ngayong mga bago, 585, 577 nanometers. Very effective.
Thank you.
Okay, I missed this question. So what can you recommend for acne-prone skin?
For acne-prone skin, usually pag acne-prone po, most of the time it's oily. So I usually recommend to use products that help control sebum production. So products include salicylic acid, which is a an acid that goes inside your pores. It's oil loving, so it clears out your pores, makes you less oily. Of course, your retinoids also. So your retinoids, apart from anti-aging and everything, it also regulates yung sebum mo, and also prevents yung pagkumpul-kumpul ng dead skin cells, and prevents mga comedone formation and eventually acne. Benzoyl peroxide is also one. It's also a keratolytic and a chemolytic, so it dissolves comedones, it regulates skin turnover. Niacinamide is a weak anti-acne din. Pwede din po siya. Ano pa ba? Azelaic acid is also good for acne prone, especially for pregnant and breastfeeding, because it's safe po siya gamitin for pregnant and breastfeeding. For those who are sensitive to salicylic acid, you can try polyhydroxy acids, the newer hydroxy acids like your gluconolactone. And then, ano pa ba? Green tea. Green tea is also, you can see it in some of the skincare products. For those with mild na oily skin, you can also use green tea. And then mattifying products. So marami po tayong moisturizers you can buy that contain mattifying ingredients like your dimethicone and stuff like that. So yun po yung ma-recommend ko for those with oily acne prone skin.
Okay. I have a question. What about, kasi di ba gravity is a culprit. What about sleeping on your stomach? Is that good for your face?
Ay, Doc, meron akong video niyan. For those of you who are interested in watching videos, I have a YouTube channel. Nung ECQ yun lang ginawa ko, nag-record ng mga videos. Doc, sagutin ko na ba?
Sure.
So, okay. Ano yan, Doc, eh? Parang pros and cons yan. So, if you look at me, here, ayan. This is deeper, di ba, Doc? This is because I really sleep on this side. So, there is truth to that, because imagine, when you sleep on this side, nakaganon yung mukha mo for like 8 hours or at least 6, di ba? So it really causes like that deep crease. And you will notice that because when you look at your patients, meron siyang lines na parang weird. They are not formed by expression. So meron dito, then meron dito. So those are called sleep lines. And they are real. And ako, nagsisisi talaga ako na hindi ko siya pinansin before. So, yung mga bago pa lang dyan na wala pang sleep lines, totoo yan. And they say that using pillowcases that have soft and smooth texture can help. At kasi apart from parang making your skin slide, it doesn't absorb also the oil on your face. So, it doesn't leave your skin dry. So, sabi nila yung silk daw, like mulberry silk or something, and then your cotton satin sheets help. But on the flip side, for some patients, it's kind of hard to sleep upright because they have sleep apnea or parang nahihirapan sila huminga. That's my reason actually, Doc. Kasi allergic rhinitis. So I really find it hard to sleep upright. Parang nalulunod ako. So even if I try to sleep upright in the beginning, I always end up on one side. So ano siya? Pros and cons. I know that they sell pillows that keep your head upright, but I don't know if that's a worthwhile investment for a lot of us. But yes, sleep affects your skin.
Okay. Ang daming, I think you all are shy, so I have questions here. Maybe that's 2 questions. Jewelry. Does jewelry affect our skin condition? Should we wear only true gold? Or can we wear fancy ones?
Ulit, Doc. Ako kasi, Doc, I have nickel allergy. So if you have nickel allergy, definitely avoid wearing fancy jewelry kasi it's a nightmare talaga. And dami pa naman magagandang fancy jewelry, di ba? I like buying, Doc, yung mga, alam mo yun, yung mga malalaking whatever. But every time I wear it, I make sure to when I buy it, I coat it with nail polish. Well, as long as you're not allergic to nail polish, I coat it with nail polish. And then every time I wear fancy earrings, I coat it with a steroid. And then before I put it on my ear. Kasi kung hindi, talagang maga yung ear ko, Doc. But for those with no allergy, by all means, use all the fancy jewelry you want. It won't naman matter po.
Okay, there's a nice question here. How do you treat lines on the décolletage? So yung cleavage lines. So this is one aspect na sometimes I know there's some people who are prone to having very dry skin in this area, or how do you treat lines on this, or how do you take care of your décolletage?
Doc Roche, you wanna go ahead first?
Same as the face po, primarily prevention. So most of us, when we apply things on our face, we forget the décolletage. So what you put on your face, you also put on your neck and your décolletage. Pero kung La Mer siguro yung gamit mo, huwag mo nalagay sa singit mo, di ba? Pero same pathophysiology naman, Doctor. Loss of collagen and all those good stuff as we age. So if you haven't started early and you already have those lines, similar pa rin naman ng treatment together with the face. You can also apply those peeling agents to stimulate yung cellular production. And also ano lang, call back lang doon sa acne prone skin. Don't forget, syempre, you still have to apply moisturizer. People think kasi when they have oily skin that they shouldn't apply moisturizer. You just have to be very selective. Choose one that's lightweight, more water-based, and you can still also apply mga oils, but also be selective. Argan oil masyadong kulob yun eh. Always think of your skin as something you want to protect and cover, but you don't want to suffocate. Ayan. So, not plugging, but I think maganda yung squalene oil. Not the edible one. Merong squalene parang serum type. Very lightweight and helps yung ma-replicate yung natural oils of your skin.
Okay.
Doc, I do to add to what Doc said. You can also do treatments with us, like your radio frequency or your ultrasound. Pwede din siya on the neck area. Lasers even.
Oh, there's a question here from Jingo. How do you minimize large pores on the face?
And sige, Doc, sagutin ko yan. So,
Sige.
unfortunately, we are born with a fixed size of pores. So, pasalamatan po natin yung mga magulang natin sa pinamana nilang pores sa atin. And contrary to popular belief that pores shrink and widen secondary to changes in temperature, that's not true. Our pores can appear large when they are filled with oil, dirt, and debris. Also, when we age. So, may mga patients ako sinasabi na, Doc, ba't nung bata pa ako, wala akong pores, ba't ngayon visible na sila? We have to remember that our pores are also supported by collagen and elastin. And as they weaken, syempre, open din siya. So, in order to minimize the appearance of large pores, you have to identify which of these two factors yung nagkakos ng large pores. So, if it's oil, dirt, and debris, then you exfoliate, you use products that control oil. If it's decrease in collagen and elastin, then you do things that stimulate it, like your laser toning, or you can even apply retinoids, etc. Or, kung minsan naman po, patients come to me, Doc, ang laki ng pores ko, yung pala ice pick scars. So, pag ice pick scars naman siya, iba din po yung treatment doon. We can do TCA cross, we can do laser resurfacing, we can do deep chemical peels, laser toning. So, yun po yung that's what you can do with large pores. But, yun, if oil and dirt and debris yung cause niya, you can apply products that reduce oil.
And stop pricking your blackheads and using those.
Ginagawa ko din yung Doc minsan.
Pero don't do it regularly kasi mas natatraumatize yung pores. It's not actually that pores get smaller when you're applying your skincare regimen or having all these treatments done. It's because those dirt and debris that get stuck inside get melted off so that your pores become less visible. So important yung Dr. mentioned earlier, salicylic acid, because it's able to penetrate inside those pores and get rid of that debris. So debris. But it has to be, like I said, it has to be a lot of products talaga. Sorry, there's not just one product for all.
So I have two more questions before we end this open forum. So is there a regimen for body acne?
Ako, usually po, pag body kasi parang sobrang gastos if gagabitan mo ng mga creams for the face. So, depending on, usually kasi pag body, we suspect two pathogens. Can either be the Cutibacterium acnes or yung minention ni Doc kanina na Malassezia furfur, which causes Pityrosporum folliculitis or Pityrosporum ovalis siya. So, normally, pwedeng anti-dandruff shampoo So lather onto your back, leave it on for 15 to 20 minutes, rinse, and do it 3 times a week. Or if you're really suspecting acne, you can do benzoyl peroxide washes. Just leave it for a bit longer compared to when you use it on your face. And then yung mga sprays, marami na ngayon, Doc, na mga azelaic acid spray, salicylic acid spray on the back, ganun. Pwede naman. If hindi pa rin, then pwede ka naman mag-oral, but siguro guided na lang by your derm para yung dosage, etc.
Okay. Si Doktora.
And ano lang, adjunct lang, Dr. do sa malassezia. So a lot of people, they mistake nga those small white bumps for whiteheads. Tapos they wonder bakit di siya nawawala no matter what they put or no matter how many times you go to have it prick, ganyan, they still come back over and over. So a good way for you to test whether it's malassezia is to get an anti-dandruff shampoo nga. I used Selsun Blue. Pero again, no plugging. Pwede namang Head and Shoulders. You put it on whichever. Patch test mo yung area na may mga bumps kang ganyan. Leave it on for mga 10 minutes. Para siyang mask, pero anti-dandruff mask. And if it improves after a couple of sessions like that, doesn't have to be every day. Pwede nga 2 to 3 times a week. Then that means it's malassezia. So it's not bad. It doesn't mean you're contagious or anything. It's just it's just there on your skin. So
We all have it.
yeah.
Iba lang dumadami.
Yeah. So once in a while, I
Right,
still do that. Pag may 1 or 2 bumps that I see, I still do that Selsun Blue mask. Tapos, oh yan, wala na siya. I used to think it was Milia pero hindi pala.
Okay. So I last 2 questions. Sorry, I may dumagdag pa. So what about the use of aloe vera gel as a moisturizer? Is this helpful?
Yung anak ko, Doc, gusto niya. Aloe vera kasi as an ingredient. We know, alam mo yan, like ako Doktora, I grew up with my lola, Mama Kalayan. Meron siya, marami siyang sabila. Alam mo yung sabila, Doc, di ba? And then kinakat niya, sinalagay niya sa buhok niya yan. Like every day, sa scalp, sa hair, alternate with gugo, ganyan. So I grew up with aloe vera. It's a very good ingredient known for its healing and soothing properties, calming, ganyan. But now kasi I think what you're referring to, Doc Jingle, is yung nakikita na nakalagay sa ganon, di ba? So ako, pros and cons, again, it's usually gel. So, it's a little bit drying for some with dry skin already. Kasi, ano siya gel siya, so medyo may alcohol siya. So, when you put it on your skin, di ba parang ang lamig niya and then after that, dry na siya. So, if you have oily skin, I think it might be a good moisturizer. But just be cautious lang if you have dry skin because it might end up drying your skin more. So, okay naman siya. Like I said, my son likes it. He likes the consistency.
Very good moisturizer, aloe vera. You just have to be very selective, especially when yung mga nasa availables kasi sa grocery a lot yun, di ba? Yung nasa giant tub or yung mga sobrang cheap na you find, I mean, I don't have anything
That's what you
against
pay
cheap.
for, though.
Kasi
Yeah.
there are a lot of products there that are cheap because they just put the ingredients pure, pure, no additives. Pero a lot of times kasi, especially if you don't know yung mga foreign language, ganyan. You don't know, baka mamaya it's from China, mass produced. You don't really know what's in there. So when you're using a commercial aloe vera moisturizer, just make sure to buy from a trusted company. Pero kung meron kayo maraming aloe vera plants sa house, go. Very good, natural. And for those with dry skin, that won't be enough. So you have to layer it again with a more occlusive oil.
So that's a tip. Magtanim na kayo ng aloe vera sa inyong bakuran para you can use it. There's another question here. Last question before we wrap up this session. Are clay masks good as exfoliants? So yung clay mask, I guess the dark thing, yung parang
Actually,
putik sa mukha.
Yes. Yung clay po, they've become popular. Well, ewan ko, baka nahuli na ako. But I think since 2019 or 2018, yung mga Aztec clays, yung clays kasi per se are very drying. So, those with oily and acne-prone skin will find it very helpful. But it's not considered an exfoliant. And I don't recommend that even those with oily and acne-prone skin use it every day kasi drying talaga siya. So definitely for those with dry skin, choose a different mask. But for those with oily acne-prone skin, you might find it helpful, but it's not considered an exfoliant po. It really just absorbs the oil.
We can't let you go yet because now there's a question about hair. So, any suggestions on how to treat dry hair pagka masyado kang nag-iisip? Nag-stress ka, nagda-dry yung hair mo, nagfo-fall, or namumuti like mine, which I don't care if it's white. So is there any
Platinum blonde yan, Doc. Hindi yan white. Di bago
no
na ngayon.
color?
Uso yan, Doktora.
Yeah.
But when it comes to hair po, ayan, si Doc Roello, buti ng kalbo siya. When it comes to hair, actually, sobrang dami po ngayon na nagsasuffer ng hair loss because of a mixture of causes, stress, lack of vitamin D, or lack of nutrients, etc. But ako po, I'm very particular din with hair kasi di ba, it really matters. Di ba, parang your hair can actually define how your face looks, you know. Dry hair, number one, can be caused by a lot of things. Number one, it can be caused by overwashing or using the wrong shampoo. In other countries, they even recommend, again, this doesn't apply to the Philippines because we're very humid, but you will probably read a lot of articles like in the US, Europe, or even Korea that they say only wash your hair twice a week. The reason for that is because yung hair natin, just like our skin, is coated with lipids, moisturizers, etc. And every time we shampoo them, sinistrip natin to of its natural moisture. So when you do that, syempre you leave your hair fragile, brittle. It can cause dryness, split ends, etc. So for someone naman who has oily hair rather, na kailangan talaga mag-shampoo every day, I recommend using gentler shampoos with siguro mga milder surfactants and focusing on the scalp rather than on the hair mismo. And to not forget to condition because conditioners are moisturizers for the hair. And one tip, yung mga mahilig sa VCO, virgin coconut oil is actually a very good emollient moisturizer for the hair. Kasi parang it prevents yung, kasi when you wet your hair, nagsaswell siya eh. So pag nag-swell siya to shinampo mo, nagkakaroon siya ng parang ganun-ganun do. So nadadamage, nag-open yung cuticle, nadadamage siya. So when you don't put moisturizer and seal it in, madadamage talaga siya. So that leads to dry, brittle hair, split ends, etc.
Okay, so there's a comment here, buti na lang kalbo. So I guess I think even if you don't have hair, you still have to take care of your scalp, no? Because it's also prone to skin disease and skin disorders, Roel. So with that, I will wrap up this session, our Q&A. It has been very fruitful, very informative, and the takeaway here is embrace your age. It is not for you to make yourself look younger, but to age gracefully. So back to you, Joy.
Thank you, ma'am. Parang ayaw mong i-end kasi ang daming mga gandang mga tanong. And I'm sure a lot of people want to ask more, but because of the time constraints, we have to end. Siguro the AWSP can prepare a part 2 of the session in our future webinar. So again, congratulations to our speakers and thank you very much for accepting our invitation to speak tonight. To present the certificates of appreciation and to give us our closing remarks, may I call on the President of the Association of Women Surgeons of the Philippines, Dr. Anita Tarectecan.
Hello and good evening. Thank you very much to our speakers for accepting our invitation. Ma'am, kindly share the certificate and thank you. The Association of Women Surgeons of the Philippines, in partnership with the Philippine College of Surgeons, presents the Certificate of Appreciation to Dr. Irene Gail Robredo Vitas for her invaluable participation as a speaker during the webinar on skincare for busy ladies, given this 9th day of September 2021. Signed by our board secretary, Dr. Joy Grace G. Jerusalem, and our PCS president, Dr. Antonio Sai, and yours truly, Dr. Anita Tarectecan. Thank you very much, Dr. Vitas.
Thank you,
And of
Doc.
course, also For our plastic surgeon, same contents to Association of Women Surgeons of the Philippines, in partnership with the Philippine College of Surgeons, presents the certificate of appreciation to Dr. Rosalyn Ann P. Ganaban for her invaluable participation as a speaker during the webinar on skincare for BC ladies, given this 9th day of September 2021, signed by Dr. Joy Grace Jerusalem, our board secretary, our PCS president, Dr. Antonio Sai, and yours truly, Anita Tariktekan. Thank you very much. Meron pa tayo? Okay. So sa ating closing remarks, hello again and good evening na. Good evening to everyone. We had a very informative, interesting, and complementing discussion on skincare and beautification. So I like the video on age transition. Ang ganda. And also, of course, merong word for the day. Feel refreshed. No? So our webinar activities in line with the celebration of the ATP founding anniversary foundation week, actually a week-long activity of the Philippine College of Surgeons. So happy anniversary to PCS. And of course, note na ang ating motive for this webinar is red wine, sabi ni Dr. Connie. We would like to thank the President of PCS, Dr. Antonio Sai, for gracing our activity. And of course, our guest speakers, they're distinguished and amazing speakers. We have Dr. Irene Gail Vitas, our dermatologist, and complementing her is our plastic surgeon, Dr. Rosalyn Ann Ganaban. Thank you very much for a very informative and beautifying lecture. Thank you also for our sponsor, the ADP Pharma, care of Miss Kathy Carpio. Thank you very much for your continued support to our series of webinars. And of course, thank you to all our participants in behalf of the Association of Women Surgeons of the Philippines, Board of Trustees. Thank you to all our participants in the Zoom, Facebook, and Docwity, in other social media platforms. We hope you again join us in our succeeding or next webinars. Maraming salamat po sa pagdalo, and be safe and healthy. Thank you. Thank you, everyone.
Thank you, everyone, for joining us tonight.
Thanks, everyone.
Thank you.